Good evening to you, Doc. Thank you very much for joining us. Am I correct that we've already had a case where COVID-19 has been passed from mother to unborn child coming from Durban?
I don't know the specifics of that case and what was actually happening around it. But I think what we need to clarify is whether the virus gets passed on in utero, so whilst the baby is inside, or whether it happens after basically the delivery. And of the scientific data that is there at the moment, we don't seem to see the transmission during the time of the pregnancy, but which then leads us to the importance of continuation of the hygiene between, especially for the mom, is after delivery, because that's when generally it would happen.
I see. So there's I mean, there's so much we don't know about COVID-19, but no clear sign that it does pass in utero to the baby. If a woman is pregnant and then has COVID-19, is there any harm for the baby?
Like I said, at the moment, it hasn't been shown. I mean, there was a small study that was done where they looked at things like, does it cause spontaneous miscarriage? Does it cause preterm labor? And none of those seems to be related to the COVID at the moment, yeah.
Are women who are pregnant more at risk of developing COVID-19 or more at risk of being infected by it? And could they develop the more severe version of COVID-19? Are they at more risk in that sense?
Again, no. Actually, when we looked at everything that's currently available, it doesn't show that women who are pregnant are more susceptible. But there was a study that was done, I think it's also in China, in Wuhan, was that if a mom or a pregnant woman does get severe disease, compared to their counterparts who are not pregnant, they are more likely to be severely affected. But that's when you've got like severe respiratory disease.
Now, we do know that there are strict rules under our lockdown and strict rules in any hospital. For a mum going into hospital to give birth, what are the rules because of COVID-19 that might restrict what she would normally expect? So could her birthing partner, would she be allowed a birthing partner when she goes into labour? Is her partner allowed to be with her? That sort of thing. How are there any different rules at this time for her?
Yeah, absolutely. I mean, what makes it difficult is that sometimes pregnancy or labor starts spontaneously as an emergency and you don't have time. But for the most of the hospital, as far as I know, one of the things that we are implementing is that moms should have at least a negative COVID testing around the time of delivery, so at around about 38 weeks. If it is a planned delivery, for example, a cesarean section, it makes it a little bit easier because then they can plan appropriately. I know a particular hospital where we are even asking the partner to have a COVID testing done so that they're able to come in during visiting hours. Of course, when it comes to things like having a doula or a partner present throughout the laboring, those things are not in place at the moment. And I think it's important to highlight the fact that every single hospital, healthcare facility, the important thing is to make sure that both mom and baby are safe, but also that the healthcare professionals are safe. So this is not necessarily to, squash the joy out of
I think particularly of mums who are going to be giving birth when we expect the peak of the pandemic, which is sort of August, September. There is concern that if you were planning a Caesar, there might not be the surgical staff available, and that mums maybe should really more strongly consider natural birth. There might just not be the beds. Is that a very real fear, or have we bought ourselves enough time to make all those plans?
Look, I think part of the implementation of the lockdowns, the flattening the curve, is for that very reason that at any given point, we never overwhelm the system beyond what it can actually take. And as a result, you end up having complications that shouldn't have been there. So I wouldn't necessarily say that it is a reality, but when it comes to particularly pregnant women, we are prioritizing their obstetrical care as much as possible over and above the COVID-19.
Thank you so much for that reassurance. That is Dr. Mpume Zenda. She's a gynaecologist and obstetrician, just telling us what to expect if you're expecting during this pandemic.